is Vanessa Palma. Today I will be demonstrating how to insert an NG tube. So before I get started and before I enter my patient's room, I do want to double check my orders and ensure that I have the correct physician order for this procedure. I have ensured that I do have that, so now I will go ahead and enter my patient's room. Hello, my name is Vanessa. I'm going to be your nurse today. Could you confirm your full name and date of birth for me, please? Okay, patient has verbalized full name and date of birth. I'm going to verify that information by checking their wristband. Can I see your wristband, please? Okay, patient has showed me the wristband and I have verified that the information is correct. Okay, Mrs. Smith, so the doctor has ordered the insertion of an NG tube for feeding purposes. So an NG tube is a tube that goes from your nose to your stomach, okay? I'm going to be completely honest, this procedure is a little bit uncomfortable, but I am going to do my best to be as fast and as gentle as I can be so we could just get through this quickly, okay? Do you have any questions or concerns for me? Patient denies having any questions or concerns, so I will go ahead and get started. Before I do go ahead and get started, I just want to show my materials. I have my tubing here, a basin with warm water, a specimen cup, and for today's purposes, this will be a pH stick, cup of water for the patient with a straw, pen light, syringe, gloves, a chuck, a basin, and I have some lubricating jelly here. And I also have some pre-cut pieces of tape. And I don't have a safety pin, so I will just verbalize that step when I get to it. Okay, so before I get started, I'm going to do hand hygiene. Okay, I'm gonna go ahead and don my gloves. Okay. Okay, Mrs. Smith, I'm just going to place this towel here. During this procedure, it is normal for you to gag. If it gets to be too much, however, you just go ahead and let me know and we could take a break, okay? So, I'm going to grab my tubing and the first thing I'm going to do is measure. I'm going to measure from the tip of my patient's nose to the tip of the earlobe. Oh my goodness. Sorry. Okay. Tip of the nose, tip of the earlobe. And then down to the xiphoid process. So for this particular patient, it does bring me to about 50. Okay, I'm going to mark that with a piece of tape. The reason I'm going to mark this is so that I know where to stop my insertion. I don't want to go too far and I don't want to be not in enough. Okay, so while I prep my other materials, I'm going to place this tube in a bin of warm water. The reason for that is to warm up the tubing to make it a little bit more comfortable during insertion and also to make it more pliable, to make it easier for me to insert. Okay, so now I am going to check your nostrils. I'm going to shine this light in there just to ensure that there's no abrasions, no bumps, nothing clogging the nares, okay? Okay, right nair looks great, left nair also looks great. Okay, so now Mrs. Smith, I am going to ask you to occlude one nair and just breathe in and out through the left. So go ahead and occlude the right and you're gonna breathe in and out through the left. Okay, now you're going to repeat that same thing with the right side. Perfect. Okay, so Mrs. Smith's right side is has better airflow, so that is the nair that I'm going to use for insertion. Okay, so I'm going to grab my tubing. I'm going to place one end into this lubricating jelly. Mrs. Smith, this jelly is just going to make the tubing glide in a little bit easier, okay? It's gonna make the process a little bit more comfortable. And I didn't verbalize it before, but my patient has been in high Fowler's position, and I did move the bed up to a comfortable working position. She has been in this position that whole time. I just forgot to verbalize it. Okay, Mrs. Smith. So when I first insert this tube, you're going to hyperextend your head back, okay? And once you feel it hit the back of the throat and possibly makes you gag a little bit, I'm going to have you lean forward. I do have this cup of water for you, and while I'm inserting the tube more, you're just going to take small sips of water, okay? It'll just make it a little bit easier for you, okay? All right, so I'm going to go ahead and get started. And I do want to follow the natural curvature of the tubing, which I believe would be this way. Okay, I'm gonna go ahead and go in. Okay, so Mrs. Smith has started gagging a little bit, so I'm going to offer her small sips of water, and while she is swallowing the water, I'm going to insert the tubing 2 to 4 inches more each time. Okay, and then she has also leaned forward. All right, Mrs. Smith, you are doing amazing. Go ahead and just keep taking small sips of water. We are almost there, okay? All right, I'm going to keep inserting, keep inserting. Okay, I'm almost there. Almost done, Mrs. Smith, almost done. You're doing great. Okay, so I have reached my mark with the tape, so I'm going to stop inserting now. I am going to grab my syringe, and I am going to I'm going to pull back 5 to 6 cc's of gastric content. 5 to 6, sorry, 5 to 10. Okay. Okay, there we go. I'm going to take this specimen and I'm going to place it in my specimen cup. So now I'm going to discard of this. I'm going to take my pH strip and ensure that it is at the right pH level to ensure that it is gastric content that I removed. Okay, I have ensured that it is. I'm going to discard of this in the proper receptacle. I don't think that's the right word. In the proper bin. I'm going to also move away my specimen cup. I have now ensured that I am in correct placement. To further ensure that I am in the correct place, I would request for an x-ray to make sure that it is in the stomach and nowhere else. Okay, so now that I know I'm in the correct place, I'm going to secure it with some tape. I'm going to just secure it right here. Okay, Mrs. Smith, how are you feeling? Okay, patient says she feels okay. Since she is getting feeding, I'm going to connect this to the feeding tube and to the feeding pump. I will continue to ensure that the tubing is patent. Before I start feeding, I'm going to flush it with warm water, and after the feeding is done, I'm also going to flush it with warm water just to make sure that there's no blockages or anything wrong with the tubing. And I'm going to discard of this, remove my gloves. Mrs. Smith, we are all done. Do you have any questions for me? Mrs. Smith denies having any questions or concerns. I'm going to do hand hygiene. I am going to document how she tolerated the procedure, document the pH of the gastric secretions that I pulled out. I'm going to document that I have connected it to the feeding and everything seems good. And I'm going to do hand hygiene. Don't know if I already said that, but hand hygiene, and I will exit my patient's room. Okay, and that is it. Thank you.